Dr. Arnold, my wife's pregnant. Lots of people's wives are pregnant. How can chiropractic care help pregnant women?
It's a well-known fact in the chiropractic profession that adjusting women when they're pregnant is a very effective thing. The reason being, and I tell this to women that come in when they're pregnant, is what better time or when would you want your pelvis to work the best it ever needs to, and that's when you're going to have a child and that pelvis is going to open up and deliver that baby. From a nerve system standpoint, you know, a lot of pregnant women get sciatica, they get dull, achy pain, and I know medically they basically tell the woman that it'll go away after you deliver, and that's not always true. From our standpoint, it indicates that there's probably some structural issues there. Pregnancy is just making them more evident. So from our standpoint, every pregnant lady should get checked chiropractically.
All right, and some of those concerns, I guess, as a guy, you know, you're going to be on the back if they're pregnant, especially later in the pregnancy. I mean, technically there would be some kind of wobble there. How do you give them adjustments? Are there concerns for the mothers out there that there might be some issues actually getting an adjustment?
Well, our tables accommodate the baby, so like if we're laying a woman face down, the thoracic piece drops away. So in all reality, they can lay face down on the table, the baby virtually hangs in the space, so to speak. As far as the force and the adjustments go, there again, gentle, get things done as best we can, as easy as we can. It just depends on the woman. Some women are very sensitive. You just got to basically pump their spine, not get too forceful. Some women, you need to work on their tailbone or their lower lumbars. Takes a little more force sometimes. It never disrupts the baby, never disrupts the pregnancy. There's definitely false misnomers out there about don't go to a chiropractor when you're pregnant, and that's baloney. That's the nicest word I can come up with.
And what are those concerns? I mean, I know we kind of joke about it, but what are those concerns that maybe other doctors or other medical professionals have about chiropractic care when you're pregnant?
Well, I think they get a vision that chiropractors don't have enough sense not to use a lot of force when a woman's pregnant. I mean, to me, they're not giving us the respect we need because we know how to deal with that, and they don't know that much about what we do. Therefore, when they tell young moms, well, if you're going to the chiropractor, stop. Well, to me, that'd be like telling some person that's going to the medical doctor never to go again. I mean, that's not in their realm. Therefore, they don't understand it. But the concern, I believe, is using too much force, disrupting the pregnancies, whatever. But it never happens. It just doesn't happen.